Hello, Dr. Childress here with you again. So we have our battle plans to recover mental health as your ally, but there's more for both the assault on the binding sites of ignorance and for the assault on the APA. So let me address two issues surrounding the direct assault on the binding sites of ignorance. In addition to separating the pathogen from the binding sites that are infecting and disabling the mental health response to the pathogen, there's a second important reason to file licensing board complaints against the binding sites of ignorance, and that's to protect your allies and your child's allies in mental health. When your allies in mental health stand up and identify the pathology, they're going to be attacked by the pathogen with a licensing board complaint against them. Truth and reality are not limiting factors on the actions of the pathogen, your ex. If you're unable to protect your allies in mental health from the retaliation by your ex, why should your allies stand up to pathology if they're going to be attacked by the pathogen? If a mental health professional stands up for you and your child and identifies the pathogen by making the appropriate diagnosis, the narcissistic borderline parent is sure to file a licensing board complaint against this mental health professional. How dare you say I'm psychologically abusing the child? You're incompetent! As you well know, your ex is extremely vengeful and extremely retaliatory. When the mental health professional penetrates the pathogen's veil of concealment by formally diagnosing the pathology, that mental health professional is very likely, at almost 100%, to face a retaliatory licensing board complaint from the narcissistic borderline parent, from your ex. In all the years I was working with ADHD, family conflicts, and children in the foster care system, I never faced a licensing board complaint. But since coming to work on parental alienation, I've twice identified the pathology to the court, and in both cases, the narcissistic borderline parent filed a retaliatory licensing board complaint against me for identifying the pathology to the court. Neither complaint came to anything because I didn't do anything wrong. But if you cannot protect me from retaliation from your ex, why should I place myself and my career on the line for you? This is important to understand. Licensing board complaints are very serious matters. You'll be threatening the very livelihood of this mental health professional. If they lose their license, their career's over. All their years of study, gone. And they can no longer support their families. So you're threatening their ability to support their families. So those narcissistic borderline parents who filed retaliatory complaints against me for identifying the pathology to the court were essentially threatening my wife and my kids, my ability to support my family. This pathogen is extremely dangerous and extremely vicious, and it doesn't limit itself to truth or accuracy or reality. Every mental health professional who stands up for you and for your child will face a retaliatory licensing board complaint and will have their career and family threatened by the retaliatory revenge of the narcissistic borderline parent, your ex. If you can't protect us, if you can't protect our families, why should we risk ourselves for you? Before we can expect mental health professionals to stand up for you and your children, to place themselves and their families at risk from the pathogen's revenge, we will need to protect these courageous and ethical mental health professionals, your allies and the child's allies, from the retaliation of the narcissistic borderline parent. How do you protect us? By becoming as dangerous to the allies of the pathogenic narcissistic borderline parent as the pathogenic parent is to us, your allies. The first time the licensing board receives a complaint from you, a targeted parent, on the grounds of an attachment-based model of parental alienation, the licensing board isn't going to know what to do with it. When you file a licensing board complaint against a binding site of ignorance, cite as your grounds an attachment-based model of parental alienation as specified in Foundations. Because you specify an attachment-based model of parental alienation as described in Foundations within the grounds for your complaint, the investigator will need to read Foundations in order to be able to properly evaluate your complaint. You have now educated the licensing board on an attachment-based model of parental alienation. Now, the licensing board isn't likely to take any actions against the mental health professional probably referencing some concept of community standards of practice. They'll still be operating under the old Gardnerian response. Parental alienation is controversial and lacks scientific foundation. But to the extent that you use the professional words of power given you in Foundations, that the mental health professional failed to have a proper expertise in personality disorders and the attachment system, role reversal relationships, and the transgenerational transmission of attachment trauma, mediated by delusional beliefs created within a reenactment of childhood attachment trauma, you'll make it increasingly difficult for the board to disregard the lack of specialized professional knowledge and expertise that was not possessed by the mental health professional, but which was needed to diagnose and treat your family. By your board complaint against the binding site of ignorance, you'll force the licensing board to read Foundations and to become knowledgeable. 1 complaint dismissed, 2 complaints dismissed, 3, 4. How many times are they going to cover up for the ignorance and incompetence of therapists, ignorance that is destroying the lives of children and families? 5 complaints, 6. The licensing board is going to become increasingly uncomfortable covering up for the ignorance and incompetence of mental health therapists. The licensing boards are going to begin turning to professional organizations like the APA for guidance. Is this a standard of practice expectation? This will dovetail with your colleagues who are assaulting APA asking for a change to the APA's position on parental alienation that identifies your children and your families as a special population. The licensing boards are asking for direction from APA. You're asking for formal recognition as a special population requiring specialized knowledge and expertise to competently assess, diagnose, and treat. We are keeping the pressure on to expose the pathogen, to break its veil of concealment once and for all. Controversy swirls. Everyone's reading Foundations to be able to evaluate the situation, decide what to do. Mental health is becoming educated. We generate publicity that warns therapists that if they do not make the proper diagnosis in cases of attachment-based parental alienation, then they'll likely face a licensing board complaint from you, the targeted parents. You have become dangerous to ignorance. Into this swirling mix, your ally, your child's ally, a knowledgeable and competent mental health professional, identifies the pathogen and makes the correct and warranted diagnosis of child psychological abuse confirmed, based on the presence in the child symptom display of the 3 diagnostic indicators of attachment-based parental alienation. Your ex, the narcissistic borderline parent, will become outraged at the diagnosis and will file a licensing board complaint against the competent mental health professional, your ally. This competent mental health professional, your ally and the child's, will then respond to the board complaint with a defense based on Foundations. And I'll have more on this on my website about this defense going forward. A board defense based on Foundations. And by your prior board complaints against the binding sites of ignorance, you've already educated the licensing board regarding an attachment-based model of parental alienation. When the licensing board receives the defense of your ally, the courageous and competent mental health professional who stood up and did the right thing, the licensing board will fully understand the pathology. They'll review the solid documentation of the assessment and the presence of the 3 diagnostic indicators. They'll fully understand that the narcissistic borderline personality is extremely vengeful and retaliatory, and your ally, the courageous and competent mental health professional, will be protected and safe. Once the pathogen is no longer hidden beneath a veil of concealment, it loses its power, even the power to attack. Everyone sees it, and everyone understands the attack for what it is. By filing licensing board complaints against the allies of the pathogen, the binding sites of ignorance, you are serving to educate the licensing board on the pathogen and the pathology of attachment-based parental alienation, so that when the pathogen tries to retaliate against your ally and the child's ally, who courageously stands up to the pathogen and makes the correct diagnosis, the licensing board will be educated and your ally will be safe and protected. You protect us by becoming as dangerous to the allies of the pathogen, the binding sites of ignorance, as the pathogen already is to us. But this will make the subspecialty field of psychology extremely dangerous for mental health professionals. If you make the diagnosis, you'll face a licensing board complaint from the narcissistic borderline parent. If you don't make the diagnosis, you'll face a licensing board complaint from the targeted authentic parent. Either way, you're going to face a licensing board complaint. This becomes an exceedingly dangerous subspecialty area of practice, requiring specialized knowledge and training to competently assess, diagnose, and treat this special population of children and families. This may mean that mental health professionals will stop accepting cases, will stop working with cases of parental alienation. Good. This is exactly what we want. The mental health professionals who flee because you are now dangerous to the binding sites of ignorance, the allies of the pathogen, you have become dangerous to ignorance, and the ignorant allies of the pathogen have fled. Your allies, us, will stay. Your being dangerous is no danger to us because we see the pathogen. We know what we're doing. If the number of available therapists in an area drops from 100 to 2 because you've become dangerous to ignorance, well, that's great. We've just cleared out 98 ignorant therapists. The 2 that remain know what they're doing, and this is exactly what we want. The 2 that will remain will be so busy that they'll be making tons of money, and it'll be so lucrative to practice in this field that a 3rd knowledgeable, competent therapist will soon enter, then a 4th. Soon we'll be up to 25, 50, 75 expert and knowledgeable therapists, and no ignorant and incompetent therapists anywhere to be seen. That's exactly what we want. Therapists who flee because you become dangerous to ignorance are exactly the therapists who shouldn't be working with your children and families. So if the mental health professional faces a board complaint either way, whether they make the diagnosis or not, what should they do? They should do the right thing. If the 3 diagnostic indicators of attachment-based parental alienation are present, then they should make the diagnosis, including the DSM diagnosis of child psychological abuse confirmed. And they should document in the patient record that they have conducted the assessment and that the child's symptoms displayed the 3 diagnostic indicators of attachment-based parental alienation as described in Foundations. If the child's symptom display does not evidence the diagnostic criteria for attachment-based parental alienation, then the mental health professional should make whatever diagnosis is warranted and document in the patient's record that the assessment of attachment-based parental alienation was conducted and the results of this assessment, including what diagnostic criteria of attachment-based parental alienation were not met. Mental health professionals don't need to make a clinical diagnosis of attachment-based parental alienation if the 3 diagnostic indicators aren't present in the child's symptom display. In about 20% of the cases coming to me because of alleged parental alienation, the child doesn't meet diagnostic criteria for a clinical diagnosis of attachment-based parental alienation. It's not parental alienation. Mental health professionals don't need to make this diagnosis if it's not warranted. All we're asking is that all mental health professionals working with this special population of children and families recognize that this pathogen exists and understand the nature of this pathogen so that they don't become a binding site of ignorance for the pathogen, who turns them into an ally of the pathology. All we're asking is for mental health professionals working with this special population of children and families to conduct an appropriate assessment for the 3 diagnostic indicators of attachment-based parental alienation, and then to document the results of that assessment in the patient record, including what diagnostic indicators were not met. If, on the other hand, the child's symptoms display all 3 diagnostic indicators of attachment-based parental alienation, then we're expecting all mental health professionals, 100% of them, to make the appropriate DSM diagnosis. And that diagnosis, that DSM-5 diagnosis, includes child psychological abuse confirmed. That's the diagnosis we're looking for, by the way. There's no DSM diagnosis of parental alienation. That's not the diagnosis we want because no such thing exists. When the three diagnostic indicators of attachment-based parental alienation are present in the child's symptom display, we want the DSM-5 diagnosis specified in Foundations. This DSM diagnosis includes the DSM-5 diagnosis of child psychological abuse confirmed. This is the diagnosis we will ultimately take into the legal system. The diagnosis of child psychological abuse confirmed regarding the parenting practices of the narcissistic borderline parent. This is the diagnosis we'll take into the legal system to acquire the child's protective separation from the pathology of the narcissistic borderline parent. But when we take this diagnosis of child psychological abuse confirmed into the legal system, we can't have some random binding site of ignorance, ally of the pathogen, tell the court something different out of ignorance and a failure to see the pathogen. A failure to penetrate the pathogen's veil of concealment. So before we solve the legal issue, we must first cleanse the mental health system of all the binding sites of ignorance that the pathogen is using to infect and disable the mental health response to the pathogen. On the other hand, if the child's symptoms don't display the three diagnostic indicators of attachment-based parental alienation, then the mental health professional makes whatever diagnosis is warranted by the situation and simply documents in the patient record that an assessment of attachment-based parental alienation was conducted and that the child's symptoms did not meet the diagnostic criteria because, and then specify what criteria were not met. Let me be clear on this to you, the targeted parents. If your child does not meet the three diagnostic criteria for attachment-based parental alienation, this is great news. If the mental health professional has done the assessment and has specified why the criteria were not met, don't file a licensing board complaint. They're doing their job. And by assessing for attachment-based parental alienation, they're actually doing a good job. Listen to what they have to say and work with them to make things better. If your situation is not attachment-based parental alienation, that's great news. Everything else is much more easily solvable. As long as the mental health professional assesses for attachment-based parental alienation and documents the results of the assessment, don't file a licensing board complaint. Do not threaten their career and family. That would be the wrong thing to do. That's not why I'm empowering you. But if the three diagnostic indicators of attachment-based parental alienation are present in the child's symptom display, and the mental health professional either doesn't assess for them or doesn't make the proper diagnosis, both clinical and DSM, when the three diagnostic indicators are present, then you have located a binding site of ignorance that the pathogen is using to infect and disable the mental health response to the pathology. Follow me to the next video segment.